Hello, Renee.
Hey, Chad, you in the car?
I'm in the car. I may be conducting the entire operation from the car today.
So I've got a couple of things on the agenda. Maybe they're already on yours. So,
Mine's pretty succinct. So.
Okay, I just had the changes for pre-procedure testing.
Yep.
The update on J&J shelf life.
Okay, I do not have that.
Okay, and an MVP update regarding cost share.
Okay. That sounds lovely.
Okay, so you did have the pre-procedure testing on your list?
Actually, I don't have the entire thing in front of me, so I'll just turn it over all to you.
Okay.
Lovely.
Chad, I just want to let you know I had you on mute because I could hear your that you had your window open while you were driving.
Never. It might just been the sound of the cars driving by. Give everybody another minute or so, and then we'll get rolling. All the cool kids are doing this call from their car today, just so everybody knows. Now officially done this from vacation, the side of the road, foreign lands. This is like we're just exploring new territory all the time. Need to do it from like the woods one day, just for fun, just to mix it up.
I think I've only done this from here, my basement, and I think the AHP office once, when early on.
All right, so it looks like it's about 12:16 on my watch. So we can go ahead and get rolling, just to not make everybody wait unnecessarily. So welcome back, everybody. Sorry to be doing this from not only the side of the road, but a rental car, no less. So that'll add extra degree of difficulty to it. So this will be fun. Hopefully this thing keeps running because it's not the greatest car on demand, but nonetheless. So good news is things are actually going pretty well from a COVID scenario in the world. So while I will say there has been a flattening or a little bit of a plateauing, we are certainly, despite all of the rollbacks of precautions that we've seen, not just across New York State, but really across the country, we have not seen any secondary surge to come out of that. So there is a little bit of concern that we haven't continued on a downward trajectory as much as we were, say, a week or two ago. However, the incidence, especially in some of our surrounding communities, is now sub 0.5% as far as new patients tested. I can say, just knowing today is the first day we've had 4 days in a row in Livingston County where there were actually no cases of all those tested. And I think that's true for several of the surrounding counties, that the last week we've actually seen goose eggs for the first time in a while. So that's all good news. Likewise, at the same time, everyone's probably aware that we tripped the magic trigger of 70% of New York State vaccinated. Now, if you look at the maps that the Department of Health pulls out, you'll see that the areas that are leading the state are right about 65% vaccinated. So you say, how can the best county in the state be at 65%, but yet we're at 70%? And the reality is that the Department of Health information does not include those who were vaccinated at a VA, those who were vaccinated through federal employment programs, or any other federal vaccination site. So it is not as holistic as the data that they are using at the state to report on that. So that's why there's that discrepancy, and several folks have actually reached out and asked, how's it that we're at 70% when we're only at 63% in Monroe County, for instance? And that's really the explanation as to why. We are still seeing, as we get farther south and really towards the outreaches of our catchment area, that the vaccination rate is still in the 40 to 45% range. So still the areas where we know that there's hesitancy, that continues to be an issue. And I will say, we talked about this last time, but the biggest factor that seems to be overcoming that hesitancy is the willingness and availability of primary care physicians administering vaccine. So growing more and more, the two things when surveyed that hesitant populations mention that will convince them to get the vaccine is either when it's administered by their physician or when it gets final approval and is no longer emergency use authorization by the FDA. So for the group that is hesitant but considering, those are the two factors that they cite the most as to what will move them from hesitant to getting vaccinated. So thank you to all of you who are continuing to vaccinate. That obviously is having probably the most effect, especially in our outlying communities going forward, and even in some of our harder to reach populations or more minority populations. So that's where we stand right now. As far as hospitalizations, I think we're in the 10 or so hospitalized across the U of R network. I think Rochester Regional Unity Hospital boasted it was the first time they'd been at zero since I think the beginning of the pandemic, if I'm not mistaken. Rochester Regional, the entire system, has no ICU patients with COVID. I think U of R has 5 or 7, somewhere in that range, throughout all of our ICU systems. So certainly we are seeing not only a decrease in volume across the state, but locally we're not only seeing a decrease in volume, but we're also seeing that decrease in hospitalization and severity of illness. No doubt that is largely probably because the senior population who are getting hospitalized the most are the ones who are now the most heavily vaccinated, which is good. So disproportionately, we are seeing that those who are getting hospitalized are getting younger and younger. However, the volume of folks getting hospitalized is very, very small at this point, which is good news. So that's the update with that. Certainly with access to vaccine still remains true. Anyone who wants a vaccine can get a vaccine. There are dueling clinics almost by the day, so that remains a big positive as far as access in that regard. The only other factor that I will mention, and Renee will speak to it more, there has been some revised discussion around pre-procedural testing, that there is less and less need for pre-procedural COVID testing. So I know Renee has the press release or the official statement about that, that she can give the full details. We have seen, talking to some of our specialists, there does seem to be less of a request or requirement that folks get vaccinated, but when I get tested. But when I talked to the testing site, they said as of yesterday, they had not seen a significant diminution in the volume of folks being sent for testing. So there may be a little bit of a disconnect or just a catch-up phase of that at this moment. Otherwise, I think the big story in the last 24 hours has been, because we hit that 70% plateau, that there has been the almost total rollback of the precautions across New York State, with the big caveat, and I've gotten 2 or 3 emails just this morning of what does this mean for us in healthcare settings? And the short answer is it means absolutely nothing. So if you own a movie theater, the precautions have been rolled back. If you own a healthcare facility, you're still doing the same thing you were doing 2 weeks ago. So masking, social distancing, all of that really remains the same. The only change is that in areas that have enough spacing that they have conference rooms in non-clinical areas, there is, and this is actually across URMC now as well, there is a okay to allow unmasking amongst vaccinated individuals who are in those non-clinical settings for meetings and the like. I can tell you at the U of R, for folks who have shared offices, they are still not allowing unmasking in those settings at this moment. But the anticipation is that will likely change very quickly as well for vaccinated individuals in shared office space. So several of you have reached out and said, can we stop checking folks when they come in the office? Can we stop requiring masking? The answer to that right now is no. That guidance really stays into effect. And truthfully, I'm not sure that we really will anticipate seeing a change in that masking policy and distancing in healthcare settings for any foreseeable future. I hope that changes, but the reality is that's where the sickest of the sick are, and the current mantra is to follow the CDC recommendations for healthcare settings, and that guidance has not changed. So hopefully that addresses those questions. A few other folks have reached out about questions about what does this mean for other things that we may be involved in or providing guidance for. So churches, that kind of thing. Those the rollbacks do apply to largely, although there are some settings that daycares, I think there's still some restrictions on. I can't remember all the ones that they specifically called out. Nursing homes. So there's several. Anything that has any vulnerable population, there's still the same restrictions in place. But the average day-to-day community places that we would go, if you haven't noticed already, you will probably see quite a number of people who are not masking. However, it is still surprising the volume of people who are still intending to mask, which probably is not insignificant, because there already has been some conversation that for the first time in months we're seeing people presenting with colds, flu, strips, that kind of thing that we weren't seeing at all just a couple of months ago. So it just goes to show how much hand washing and masking really does work. So with that, schools ending, the next biggest conversation is what is this going to mean for the fall, and specifically what is this going to mean about mandatory vaccination to be able to work in some settings, to be able to return to school, to return to a host of different environments. As of right now, the EEOC actually came out with a statement to say that it would not be discriminatory for a workplace to require vaccination for folks to be able to return to work in that setting. So that's a pretty strong statement. And I think that already, because of some of this federal guidance, you've seen a bit of an acceleration in the last week or two of a host of large employers who are requiring vaccination of their employees who will interact with the public, who will be live and on site. And I would not be surprised, we're starting to see an increase in number of hospitals that are requiring vaccination. And in fact, one hospital in Texas, which was, I think it was in Houston, which was actually one of the first to require vaccination, got sued, and the lawsuit just got thrown out, I think it was Friday, by the court as saying that they were not infringing on the employees' rights to require vaccination for them to return or to be able to work. So I anticipate that we're going to see more of that. We've already talked about that we're seeing from colleges and universities, a good number of them are requiring vaccination to be able to return to campus in the fall. Whether or not that will be true in public schools is still a bit of a large discussion, but I'm sure we'll be hearing more about that in the coming weeks and months over the summer. So that's all I want to say about the mandatory vaccination piece. I think that really covers everything that I had. Renee, I know you had 3 topics that you wanted to go through. Do you want to go ahead and go do yours now?
Sure, happy to do that. Thanks, Chad. So as Chad mentioned, with regard to pre-procedure testing, We have some news from Strong, and this applies, by the way, to Strong and regional locations and outpatient clinics, which is a beginning June 21st. There will no longer be a requirement of COVID testing for asymptomatic, fully vaccinated patients undergoing procedures or surgeries. Any patients with symptoms that could point to possible COVID must still be tested. Now, as you can imagine, in those 2 bullet points I just spewed off, there are a lot of details, and we'll be putting in today's follow-up email links to documents that really explain the pre-procedural COVID testing requirements for both for moderate sedation and then specifically, and then for more generally speaking, perioperative services and anesthesiology services. There's quite an extensive rubric guiding that decision making around what kind of procedures require testing and for whom. But just the short version of it all is beginning June 21st. If you don't have any symptoms you're fully vaccinated and you're having a procedure or surgery at Strong or a regional location, COVID testing will no longer be required. So more info on that in the follow-up email. Also wanted to point folks to some news about the J&J vaccine. Make sure everyone saw the news that came from New York State Department of Health reporting that on June 10th, the FDA authorized an extension of the shelf life for the J&J vaccine from 3 months to 4.5 months. So that's an additional 6 weeks. And that decision was based on data from ongoing stability assessment studies, which have demonstrated that the vaccine remains stable at 4.5 months when refrigerated at the appropriate temperature. So we'll include a link to that communication in the email today. It also includes some guidance for providers that have J&J on hand about some report and ask as far as logging into a website to enter their lot number to confirm the expiration date of the lots that they have on hand. So we'll have that information for you. Also want to make sure everyone saw some of the fast faxes coming out of MVP. One of the most recent ones I saw was announcing that effective May 26th, that MVP is going to once again apply cost share based, of course, on a member's benefits for outpatient mental health in-person visits for commercial MVP members. So those cost sharing had been waived prior to that, but effective May 26th, cost sharing will apply for those members. And then the final thing, I know Chad said I had 4, but had 3, but I really have 4 things. Wanted to make folks aware, especially those that are administering vaccine in their practice and are generously maybe also doing vaccine for folks that aren't patients, but are accompanying patients, like parents of pediatric patients. We did get some feedback that as it relates to second doses. So we want to just remind you that you absolutely, even if you did not administer the first dose to a patient, you are allowed to administer the second dose so long as you can find the information about that patient in NICES about their first dose. If you can't find the patient's information in NICES, then no, you may not administer a second dose of vaccine. But if you can find them in NICES, you're absolutely able to administer the appropriate second dose. So just wanted to share that information that we recently received on a call that we had with regard to promoting vaccine administration in primary care. So that's everything I had.
Perfect. LJ, anything you have?
No, just that it's like I'm like a broken record. Despite all of the changes, and Chad already outlined this, there are no changes with regard to schools, with regard to the symptom screening, with regard to the testing for students. But it is the wild, wild west out there. I understand from many of you. It sounds like in some schools, nurses are saying, just get a note from your doctor, you've got a cold. And I don't know even what to say at this point. We have tried to the best of our ability to make sure that everyone knows that none of that CDC or New York State guidance has changed. And so we can't disrupt for this last, how many days? 5 more days of school for the kids. We cannot make changes in that. So please do your best to sort of assess and adhere to the guidance that was out before. And I really, really, really do think that the symptom categories and that the testing guidance will change for the fall. We're definitely have a team that's looking at it, and we'll be working on this in the month of June and July, and really advocating at the level of the state and elsewhere for more reasonable criteria, and also more reasonable additional testing guidance, so that you all know what is acceptable to do within your offices or to refer for. And that's it.
So LJ, there was a question relative to that in chat. Okay.
Yeah, I just saw it. So no, so listen, the guidance around testing, I know this is the number one question that comes in through my email, so I apologize for not acknowledging that right away. In a vaccinated patient, a student or a teacher, if they show up to school or that morning of school, they have symptoms, they still have to be tested. Vaccination doesn't change your ability to, still potentially have the virus. They just have not changed the guidance around that. And because there's so many kids who are not vaccinated in schools, it's not a protective factor yet. If you are vaccinated and you're exposed to someone, you're a close contact, you do not have to quarantine. That is the only thing that's been established in the guidance right now.
There was one question, LJ, asking if we have a sense of the percentage of 12 and over, what their vaccination rate is.
I have not seen anything recent on that. Chad, do you know?
I have not. And in fact, they have not released, I've seen any great statistics on the 12 and up group at this moment, just because they're relatively new.
Yeah.
So I don't know that at this point.
Yeah, I hope maybe by the next time we all meet together, we would have an update in that space. But it definitely is not part of that 70% that's being counted. Those are adults only, right, or 18 and up.
So the one other thing that I should mention that someone else had reached out to me about was about duration of efficacy of our existing vaccine and anticipated booster. So we may have talked about duration of anticipated efficacy before, but for those who have already come due to renew their Excelsior Pass, I'm not quite yet due, but you will probably notice that in fact it does show that you can renew it for a full year. So from the date of vaccine, your efficacy by the laws of Excelsior Pass New York State are that your vaccine is good for 1 year. There is already discussion ongoing about a booster dose, likely at that 1 year time interval. And in fact, there's a study now that's enrolling at the U of R, specifically offering Moderna vaccine for those who received Moderna or Pfizer for their first 2-dose vaccination cycle a year ago. So that is just looking to see about antibody generation with that booster dose. Key things to point out at this moment. Number one, we think that you're probably going to get benefit beyond a year. The data continues to push out the efficacy a little bit farther every time they test it. But the expectation is there likely will be a recommendation for a 1 year booster. At this moment, I would anticipate that the mRNA vaccines will be the most likely for a couple of reasons. Number one, they seem to have the broadest spectrum efficacy. J&J has proven to be effective against all the variants, but the Moderna and Pfizer have seemingly had the most of efficacy, and they can be changed much more readily. So it takes about 6 to 8 weeks to reconstitute the spike protein component of the Moderna or Pfizer vaccine and then release it as an adjunct to the EUA. Whereas obviously the J&J vaccine would require a completely different reformulation, much like what we go through with the flu vaccine every year. So I would anticipate the booster will likely be an mRNA. However, there has been discussion about that folks who received an mRNA may be able to get a J&J as a booster, and that there may be some scientific validity of getting that vector as a broadening of your antibody response. The other piece that I will point out is that we are starting to see all of the variants in New York State. So whereas before we had seen the British variant, but we had not seen much of the South American and not had seen any of the Delta or Indian variant that have been circulating elsewhere in the world. Now it's 1% of the cases that were surveyed in the Finger Lakes region that were positive for the Delta variant, which you may recall is both more transmissible, but also associated with a higher risk of hospitalization. And that's the variant that really ravaged through India. It's the Indian variant, although it's now being called the Delta. The Beta variant, which was the British variant that was seen, that now constitutes over 80% of the variants, of the subtypes that are analyzed in the Finger Lakes region. I think it was 81%. So it is more transmissible than the original Wuhan strain. However, it has not been associated with a much or significant higher risk or outcome, morbidity, I should say. The important thing to note is that all of the 3 existent vaccines in the United States at this moment do show efficacy against all of the various subtype strains. The only one that has not is the AstraZeneca vaccine, which has not shown good efficacy against the Delta variant. But because that is not approved for use in the United States at this moment, that's not a factor for any of us. But certainly if we move into an AstraZeneca solution in the future, it'll be something that we'll have to talk about, especially if the Delta variant becomes a more prominent presence. But for now, I would anticipate all of us are good for a year. We likely will receive a booster. I would suspect it'll be most likely an mRNA booster, but all of those mRNA and the J&J do seem to be effective against everything that's circulating at the moment. And that's all I got. Any other points or questions that folks have? Sorry, I feel like I'm like tremoring here. It's getting hard to hold this phone against the steering wheel.
You sound like you're in a rocket. You sound like you were being launched at one point.
Fortunately, there's like 18 wheelers passing me at like 6 inches worth of spacing, it feels like. So, all right, seeing none and hearing none, we will call it a day. So we will plan to reconvene in 2 weeks. If things are really boring and not exciting, we'll send a note out and maybe extend that further. I know the U of R Command Center is now going to a monthly schedule. So we'll keep what we have on schedule for now, but then, if there's not a lot of evolution and new details, we'll send out notices and obviously continue to stay in contact via email with updates as they arise. But thanks everybody, and hope you have a lovely early to mid portion of your summer until we reconnect. Thanks very much, everybody. Take care.
Bye, everybody.